Welcome everyone. It's been a while that I haven't had a media update, and it's I just thought it would be timely. We're getting a lot of questions from the media about what's going on, where are we at with our respiratory viruses and COVID and so on. So I thought that it would be timely to have an update for the media. And we are releasing a press release as we speak now as well, just informing people what we can do to prevent further spread of respiratory viruses, and I also wanted to give you a bit of an update of where we are, both in terms of COVID and of course the other respiratory viruses, including RSV and influenza. So I'm going to start, for those of you who remember, um, my previous media briefings. I just wanted to start sharing my screen. Nick, if you could just confirm that we're seeing the local statistics, because sometimes I have difficulty with that.
Yes, we can see them, Dr. Paul.
Okay, thank you very much. So I'm going to start with sort of our local COVID statistics first. Basically, what we're seeing here really is a slight increase in sort of the trends. It's kind of easier to see on the graph here. So you could see we had a bit of an increase in November. We had a small increase in October as well. And we peaked kind of in the middle of November, and now kind of a downward trend. We still have 19 patients hospitalized and 3 in the ICU. Most of these individuals are elderly individuals with underlying medical conditions, unfortunately. If we're looking at our percent positivity, again, it's a bit skewed because right now we're only testing individuals in high-risk settings like long-term care homes, but we saw an increase in October, then a downward trend and an upward trend in the middle of November, and now you can see kind of a downward trend now. And conversely, because our outbreaks are the ones that drive the cases now in terms of what we register, you can also see that, again, coinciding at the same time of the high positivity rate and higher hospitalization rates, we had a peak again, third, fourth week of November, and then kind of a downward trend downwards into what we have now. And again, these are COVID outbreaks that we're monitoring. And finally, if we're looking at wastewater, the picture is here. It's actually, this is not correct, but you can see a downward trend here. This is because we didn't have a reading for the following plot, but you could see here that there's a downward trend in the Cornwall area, and you could see kind of a peak here and a downward trend as well. So we're all coinciding with the same time frame that we talked about. I also want to I'll talk about vaccines a bit later, but I also want to share vaccine levels. And I'll talk you through this graph. Basically, it's got the four colors. The blue represents the first dose, the orange represents the second dose of COVID vaccination, and the gray represents the at least one booster, the third dose. The green represents the fall booster, which we're giving now, which has the XBB vaccine version of it. And you could see here that among 75 plus, which, by the way, have the highest rate of mortality, most of our deaths that we've had are in this age group, are at 48.8%, which is, in my mind, quite low. It should be much higher. And then as you go down the age groups, it goes even lower. So you could see at 65 to 74, we're at 37%, 55 to 64, we're at 16.7%. And this is the age group here, 64 and over, really that needs to be at a higher rate. So I'm urging everybody to, it's not too late, please go get your COVID shots. And as you see, as we get to the younger age groups, it's virtually very low and virtually none. So that's going to be one of my messages that I'll repeat several times today. Just finally, I'm just going to show you as well that we've had continual deaths since we've had about 30 this year, and we had 7 in October, 5 in November. Again, tragically, most of these are individuals who are 75 and older, and most have underlying medical or palliative conditions. So again, although the World Health Organization has said the emergency is over, the pandemic is not over, we're still seeing COVID activity, albeit I think with vaccine and community immunity, we're seeing lower levels of this. I just want to share another graphic here. Nick, do we see this COVID trend analysis?
Yes.
Okay, thank you. I'm going to be asking you this because sometimes I have difficulty sharing. I want to make sure I'm sharing the right
Oh,
thing. Thanks, Nick.
no, sorry. Well, you'll have to, we still see the chart, the COVID-19 deaths by month in EOHU
Okay,
area.
okay, so I'll have
We'll
to
have to
go
change.
and go back in. Yeah, I'll do the same. I'll do that now. Let me just stop sharing, and I'm going to share again. That's what I want. Okay, so we'll take it there. You see a COVID trend analysis?
Yes.
Okay, so this really is. I asked our staff to give me a picture from January 2022, so we can compare October, November to this year as what we're seeing. So we could see here the hospitalizations, and again, I just kind of this is last year. This is 2022 in the fall. We had a bit of an increase here. It's stable over a couple of months here, stable over the summer, and then you could see a bit of an uptick here, which is sort of leveling off at the end of November, and it is going down now because this only takes us to the end of November. If we look at the ICU cases, they're still there, but they're lower, which to me signifies that this COVID version is less severe, and so we get less patients hospitalized in the ICU, but nevertheless, we have patients that are hospitalized, sick enough to be hospitalized. Again, more of the older, vulnerable population. Our weekly cases, again, this is more a reflection. This here is when we were still testing everybody, and that was when Omicron first started in January 2022. But if we look at sort of the trends, it's quite low, 20, 30 a week, a bit of an uptick in October, and then a bit of an uptick in November, and you could see kind of a downward trend as I described to you before. Positivity as well. Again, you could see that we had an uptick in October, November, and as I showed you, the latest one is lower, but I just wanted to sort of compare where we were last year. So we're a bit higher this year than we were last year at this time. And finally, those are the outbreaks. Again, we could see the outbreaks here that we have an increase in November, and again, and they're down now. There's a downturn to that, and this is the vaccine uptake, which I reviewed with you already. So now I just like to sort of share with you some more provincial type data, and then bring it down to the national level as well. So let's go here, share. I want to see here. This is the wastewater surveillance in the province. Nick, we see wastewater signal.
Yes, that's the one we're seeing.
Okay. Again, this is going to be updated tomorrow, but you could see sort of an uptick as well across the province. This is the Ontario numbers, and you could see Northwest is starting to go down here. Northeast is still an upward trend. Again, we're going to get the new numbers tomorrow, but Eastern as well, you could see sort of an upward trend, and we'll see likely a bit of a downward trend. But again, you could see it's pretty high compared to the last couple of months in July here. The next one is a Public Health Ontario document, which is COVID positivity and influenza together. Nick, you can see that. Again, I just want to confirm when I change.
Yes.
Okay, so COVID positivity is still high with a similar as compared to last week. This is Public Health Ontario data. And then we have influenza here, which is still in the green. It's less than 10%, but it is getting higher. I want to point out here that COVID-19 positivity is about 18.9%, similar to what we are now in our area. But you could still see enterorhinoviruses, which are the cause of the common cold, that are high, 5%. They were higher over the last couple of weeks. A lot of people were getting colds. It wasn't the flu, it wasn't COVID, it was this. And you can also see RSV as well is starting to climb up 8.5% or so. I'm going to now share with you the sort of national picture and then the provincial picture, and I want to compare particularly flu and RSV compared to last year and this year. As you can see here, there's a bit of a downward trend. This is COVID positivity, which is a bit downwards, but higher than it was last year. The dotted blue line here is last year's numbers, and this black line is this year's. The influenza is very interesting because you could see here, again, last year, if you recall, this is the blue broken line. We had a tremendous peak very early it was like by this time it had peaked. last year, and what we saw was a very sharp increase, and then a downturn here. Unfortunately, it kind of happened at the same time as RSV last year, and so what we're seeing this year though is more seasonal trends. You can see here the dotted black line represents what we saw pre-pandemic, the pattern of influenza, and it's a slow rise up until kind of January, January, with a bit of a slow decrease, bit of a plateau, and then a downward trend. We didn't see that last year, and that's because last year the virus has reset. It was the first year after several years where we took all the precautions away. And so this year we're headed towards what we call a typical influenza season, and influenza B has not started yet. It will start later on. We typically see it more in the new year, April, March, April. But RSV, you could see here, last year, again, the dotted blue line, we had already been much higher than we are today. This is the dark here. And you could see that it's following more the pattern of the black dotted line here, which is a typical RSV. And so we're now seeing, again, different levels of each of these three viruses. COVID kind of stable in the background, but nothing different in terms of what we had pre-pandemic, in terms of where we are with where influenza is now and what we're sort of looking at in terms of its progression potentially, and the same for RSV. So if it wasn't for the pandemic, I would say it's a typical flu season, but right now it's typical flu, cold season, RSV season, but we have a background of COVID-19, and that's very important because there are things that we can do both for COVID, RSV, and influenza. And I will talk a bit about that later. Just to give you sort of an overview as well, the other viruses that we talked about, enterovirus, that too typically, kind of is around. We're seeing the other viruses as well, which are the common viruses that cause the common cold. And then if you look at sort of Canada-wide by province, you could see again COVID starting to go down now, and you could also see the flu being, starting to be positive in Ontario. You could see, an uptick here. Last year at this time, it was like I said, fivefold the positivity that we were this time. And if I don't have this year's hospitalizations graph yet, because there's not enough. Last year's hospitalization graph was, if you compare it, it was quite much higher than it is this year, again, earlier on. And so really, I just wanted to, and this is RSV again, and you could see in terms of Ontario, it's around 8-10%, and again, it's a slower trajectory, albeit it's still there. So one of the reasons I wanted to have this press conference was to sort of give us sort of paint a picture of where we are. We are headed into a typical respiratory season, virus season, but at this time, but with the background of COVID-19 levels. And so what we're trying to do, so basically the hospitals are going to be facing, if it wasn't for COVID, they're going to be facing kind of typical flu and RSV seasons. However, the different context is that right now hospitals are depleted, and so it'll take less for them to be overburdened. Fortunately, we did not see the double surge with RSV and influenza this year, but there's no question about it. We're now entering a respiratory season, and the numbers are going to increase, as I showed you there before, particularly with gatherings and cold weather and people staying in. So the things that we just want to talk about really is what can we do collectively to be able to go through the next coming months without overburdening our hospitals and minimizing as much as possible respiratory virus on particularly our vulnerable populations. So when I talk vulnerable populations, I mean mostly seniors, persons with underlying medical conditions, and young children when it comes to flu and RSV. So what can we do? So let's look at COVID. COVID-19, we're still very low in vaccinations with the XBB. The XBB offers excellent protection even against a circulating sub variant of Omicron. And even with transmission, it can prevent transmission, but certainly it can prevent severe disease. We have work to do. It's not too late. You can get your vaccine at you can get your vaccine at our clinic. Go to our website, or you can also get it at participating pharmacies. There are many across our region. So that's for COVID. For flu, again, the flu shot is available and strongly recommended for individuals, for everybody. The more, the better in terms of community protection. But we want to ensure that the vulnerable population gets vaccinated. So 65 plus, we've already vaccinated our long-term care retirement homes, and anybody who's outside of a congregate care setting who is, please you consider getting your vaccine. You can get your COVID and flu shot at the same time. And finally, and in terms of vulnerable, we also look at the other age spectrum, which is young children. And again, last year, unfortunately, we had 9 deaths in pediatrics across Canada and a big surge in hospitalizations. And a lot of people don't realize that the flu is very dangerous, not only to seniors, but also to young children. And so I urge parents to get their children vaccinated for flu. They can also get their COVID vaccine at the same time. But flu, very important. Again, another tool that we have to collectively be able to decrease the burden on our hospitals and on our vulnerable. And finally, RSV, although we don't have anything right now for all children in terms of a vaccination or anything to prevent, there are some there's a new formulation. It's an antibody for children who have chronic heart conditions and so on, premature, but not for all children. However, we do have a vaccine that we're offering now to long-term care retirement homes for RSV for 60 plus population. And again, that's good. That is ongoing at this point. So we do have things that we can do for the top 3 viruses that are circulating, that we can blunt them. In addition, and just as important, are the simple public health measures that we always talk about. Essentially, we talk about washing your hands, coughing and sneezing into your sleeve, disinfecting surfaces, don't go out when you're sick, and wear a mask, particularly if you're high risk and you're in a setting that is very crowded or poorly ventilated. And so that is our goal. We want to really collectively be able to decrease the burden of hospitals on our hospitals and the burden of respiratory viruses that are going around, particularly now that we know that many people are going to gather. And it's not too late. It takes 10 to 14 days for the vaccines to work, so it's not too late to be protected around the holiday time and into the new year and even further. So again, I urge everybody to be able to, if they have any doubt about it's too late, it's not too late, please get vaccinated. And again, just follow those measures. The more that we do it, the better it is for our community and particularly our vulnerable populations, and preventing severe overburdening of our hospitals that are already starting to see increased levels of activity. I'd like to take this opportunity to thank each and every one of our community members and our media for the last year of cooperating and sharing our messages. And I wish everyone season's greetings and a happy and healthy new year.